Thank you, Speaker. I wish to make a brief contribution to the Health Service Amendment splitting of the Murrumbidgee Local Health District Bill 2025. And in doing so, can I say at the outset that I totally support this being referred to committee for further investigation and I suppose analysis. I do have some concerns in terms of automatically splitting a bill, splitting a health district. I think that it may have unintended consequences, and I think the committee would be the most appropriate place to deal with a lot of the issues which may come to light. I also would like to say that I totally respect the member for Murray and where she's coming from in introducing this bill and the advocacy that she does on behalf of her constituency, and take the point from the member for Albury about the genuineness that you have in advocating for all your residents in your communities. I also acknowledge the member for Bega's contribution and also in his capacity as the Parliamentary Secretary for Health, the expertise that he brings to his contribution and skill and experience that we can all draw on, as well as the member for Wagga Wagga and his experience and skill and knowledge of rural communities in his area. Can I just say though, access to safe, high quality and timely health care for residents in all areas, but especially in rural, regional and remote New South Wales, is a real priority. I know in my area the challenges that the Nepean Blue Mountains Local Health District has with our staffing, and it covers an area of 9,179 square kilometres. It goes from Penrith and St Mary's in the east. It goes then south into the seat of Wallandilly and Badgerys Creek, on through Hawkesbury in the north, over the Blue Mountains to the west past Lithgow, and right out and into Bathurst. So our local health district actually reaches into 7 state seats. I commend the wonderful work and dedication of all those professionals and what they bring to their jobs every single shift. I also note that Nepean Hospital has only just in the last few weeks, Speaker, only just achieved ratios in our ED. It has taken some considerable time to get the staffing levels there and fulfilling a commitment, certainly in my area, that was very, very topical 2 years ago when our state election was on. So every day people across rural and regional New South Wales receive high quality health care in our public hospitals and health centres. And in a previous life, I will say that I was on the Nepean Blue Mountains Local Health District Board quite a number of years ago, and did get to see from that inside perspective exactly what the challenges are and what they all deal with. Can I say, Speaker, in 2022-23, Murrumbidgee Local Health District did secure funding for 20 FTE nurse practitioners over 4 years until 2025-26, including funding for 4 FTE general nurse practitioner positions, rural generalist nurse practitioner positions. That's a bit of a tongue twister. To date, the district has recruited 16 FTE nurse practitioners in the areas of urgent care, paediatrics, mental health, rural generalist, diabetes, pain and emergency nursing. This has taken the number of nurse practitioners in the region to 33 FTE, which includes 14 endorsed nurse practitioners, 16 transitional nurse practitioners and 3 nurse practitioner students. After the decimation of our health workers under the previous government, it takes time to rebuild, but we are onto it. While attracting and retaining our valuable healthcare professionals is vital, we also need to turn our minds to where all these professionals will live. That is why, as part of the 24-25 New South Wales budget, our government has committed an additional $200 million to increase key health worker accommodation across rural and regional areas to the state, to be delivered over the next 4 years. It is crucial that we invest in key worker accommodation, and this is certainly a point which is part of this debate as well. We can't just say more staff if we actually don't have places to supply for their accommodation. The funding is anticipated to support the recruitment and retention of more than 500 health workers and their families in regional New South Wales by providing a range of new accommodation. The government plans to secure 120 dwellings, which includes building new accommodation, refurbishing existing properties and purchasing suitable properties. Regional local health districts, New South Wales Ambulance and Albury-Wodonga Health submitted proposals identifying current and future accommodation requirements based on workforce and service needs, which were reviewed by a Ministry of Health selection panel against assessment criteria as part of the prioritisation process. This $200 million investment builds on the $45.3 million in accommodation for key health workers in the Murrumbidgee, southern New South Wales and Far West regions, and also the $27.9 million investment in the Hunter New England and Western New South Wales health districts. Locations where delivery is underway or complete as part of the investment to deliver health worker accommodation include Murrumbidgee Local Health District, key worker accommodation units for West Wyalong, Finley, Narrandera, Leeton are now complete. Hunter New England Local Health District, Armidale, Boggabri, Glen Innes, Gunnedah, Inverell, Moree, Muswellbrook, Corindai, Singleton, Scone, Tamworth, Walker, all completed in 2023. Western New South Wales Local Health District, Barradine, Collarenebri, Condobolin, Mudgee, Walgett, all completed by June 2024. Far West Local Health District, delivery of key worker accommodation in Balranald was completed in June 2024. Delivery of key worker accommodation units in Broken Hill is now complete, with installation and site workers expected to be complete in early 2025, ready for workers to move in. Southern New South Wales Local Health District, Cooma units have been delivered and will be completed in early 2025, ready for workers to move in. This government is delivering on our regional paramedics. We have a commitment by boosting the workforce by 500. We have already seen an additional 125 paramedics commence across regional New South Wales. The next phase of enhancements is progressing, with New South Wales Ambulance consulting with staff and their unions regarding the enhancement proposals for Moree, Tamworth, Yamba, Albury, Deniliquin, Temora, Wagga Wagga, Young and Dubbo. Separate to the commitment to deliver 500 regional paramedics, we're also committed to boosting the number of intensive care paramedics. Since March 2023, 125 intensive care paramedics successfully completed their intensive care paramedic course and are working in operational roles. Of these, 71 are already working in regional locations. Speaker, since March 2023, an additional 5 extended care paramedics are working in regional locations. It's important to outline what is being done in this area. I know we all want it to happen instantly, but it does take time. And as I said, this government is onto it. I do believe that this bill is worthy of referral to the committee, as I have already said, to make sure that we do get it right and not necessarily just splitting the district without looking at all the repercussions, all the allied workers that this will affect. and I thank the House.